So today I want to talk a little bit about Florida. And maybe this will apply to other states, but full practice versus autonomous practice, which is something that's more specific to Florida. I get this question very often, and that is relating to, do we need a collaborative physician or medical director to provide IV therapy in Florida? And then part two of that question is, well, if I do need a medical director, can a nurse practitioner who has an autonomous license act as my medical director in Florida? So let's start at the beginning. So my name is Rainika Stewart. I am the founder of Adaptive Wellness and Recovery, where we provide concierge post-op care as well as wellness and recovery services here in Tampa, Florida. And I am also the founder of the Concierge Nurse Network. And when it comes to Concierge Nurse Life, I am your tour guide. So I offer many opportunities to, I have had many opportunities to help nurses in getting started in their concierge nursing businesses. So IV therapy, post-op recovery. We have now been able to support a couple of nurses with senior care and also postpartum concierge care. There are so many things that are possible, and I really enjoy helping nurses to determine what is going to be their passion and their area of expertise so that they may launch an independent concierge nursing business. But enough about me. So I do actively practice here in Florida, and I got my start back in Tennessee and Kentucky. So those are also states that I may be a tad familiar with. And then just via the process of supporting other nurses and starting their businesses, I have been able to learn a lot about other states, corporate practice of medicine. But back to Florida. When it comes to Florida, we are not a full practice authority state. A full practice authority state, for example, Arizona, New Mexico, those are a couple that I can think of just right off the top of my head. But full practice states, nurse practitioners can practice to the full extent of their license. So the full scope of what is the scope of practice as defined by that state for a nurse practitioner, and a nurse practitioner can practice within that to their full extent of the law, to the full extent of how they're licensed. So that may include procedures, that may include family practice, that will include aesthetics, for example. So nurse practitioners in full practice states can provide very specialized services such as testosterone replacement, IV therapy, medical weight loss, and there is no medical director or collaborative physician needed. So just think, sometimes these terms are used interchangeably: medical director, supervising physician, collaborative physician. Some of that depends on state, and even some of that may depend on how you're licensed. So nurse practitioners are typically going to work with and refer to their collabs or refer to their physician that they partner with as a collaborative physician. But in some states, it may be required that they are more of a medical director. So the roles, the responsibilities, what is needed, what is required, even down to possibly distance, can vary by state. Here in Florida, physicians do not have to be within a certain mileage of the nurse or nurse practitioner that they are providing collaborative services to. Usually in Florida, we call them collaborative physicians. At least I know I do. So let's just pause here and say that none of this is going to be financial or legal advice. I always tell nurses, no matter what, even with a guide or a mentor, whether you're working with me as that guide or mentor or another one, we still cannot provide CPA or accounting or legal advice. We can guide you, but ultimately part of your startup team, part of your business foundation and ongoing growth of your business should always include an attorney who is very well versed in what you will be offering and very well versed in the laws in your state. Always, that cannot be a shortcut, that cannot be skipped, okay? So in Florida, nurse practitioners were granted autonomous practice, but that autonomous practice is related to providing family practice services. So health promotion, disease prevention, wellness, preventative care, screenings, etc., right? That is what is considered under the general umbrella of autonomous practice in Florida. However, we know that IV therapy, treating obesity, those treating testicular hypofunction, aka hypogonadism, low testosterone, those types of things are in fact treated in family practice. So we typically say, and this is again not legal, but if it's something that you would treat in family practice in the scope of a nurse practitioner, we can do that autonomously. However, there's a gray area. So what I'm seeing is with us in Florida is if we're doing specialty, just like any, profession, physicians, we can specialize. If we're very specialized, that is not under the rim or umbrella of family practice. So what a lot of nurse practitioners do is we still do provide primary care services because that is, for a lot of us, I'm a family nurse practitioner, that is our foundational training. And with that said, we can integrate in testosterone replacement. We can integrate in weight loss or treatment for obesity. That is a chronic condition that can be treated in family practice, right? So a lot of nurse practitioners that are autonomous do in fact do this and still also provide other family practice services. So typically you will need to be reviewing their labs. You need to be following up. So all the things that we do in family practice, helping to coordinate other aspects of their wellness and care. If we're only doing weight loss, if we're only doing hormones or hormone replacement therapy, then that would be considered more specialized. Again, some of this is super gray, and if something were to happen, how the law is applied and interpreted to your situation may very well depend on what has happened, what happens to lead up to that unfortunate event, and who is interpreting the law at that time. So it's always, again, good to have an attorney, work with them, be sure that if you are autonomous, that your practice is set up as a family practice with family practice services beyond just those specialized type services. So IV therapy being one of them, but yes, health promotion, disease prevention. So whether a nurse practitioner has a physician for IV therapy just may vary depending on the structure and how their practice and other services that they provide are set up. So you really can't just look at one person's situation. You need to look at your services, look at what you are offering, look at your practice, look at your insurance, look at your coverage, protect yourself, and just be sure that if all else fails, you have an attorney that is advising you. So if something happens, hey, at least you can show that, hey, I'm working with an attorney. I've done everything to get my practice set up correctly to the best of my ability. That is going to look a lot better than just winging it, okay? And just going off of he said, she said, or even what I have said here. I always try to provide the best, most accurate information possible, but we all learn every day. Regulations, the landscape, things are changing every single day. So that is that. Now, the second part of that is, can nurse practitioners in Florida provide medical director or supervisory services to nurses, RNs, and LPNs? And my answer is no. My answer is no, because that is medical directors, or the ability to do that is something that is possible in full practice authority states. We in Florida do not have full practice authority, okay? We do not. We have autonomous for primary care. That is not the same thing. We cannot open a med spa and inject Botox filler, et cetera, without having a physician's oversight in Florida. So we do not have full practice authority. In those states that do, they can do all of that, all of the above. We don't have it here, and I'm grateful for what we have. It's still better than where I was previously licensed, which was in Tennessee, but we just don't have it. And so when it comes to providing medical director services, my vote is no. I have heard a few different things. I get this question quite often. So my answer is no. I would recommend having a physician. Now, what you can do with a nurse practitioner in Florida as a RN or LPN or any other profession who needs, good faith exams, That we can do. That's not to be confused with us being your medical director or providing your medical oversight. That's not to be confused with that. But yes, you can have your collaborative physician or your medical director, and then also hire a nurse practitioner who may be able or to assist you with your good faith exams. Now, I may do a whole separate video on good faith exams, but just put in short, good faith exams are the establishment of a provider-patient relationship that has to happen before a service, IV therapy, weight loss, before a med spa or type service is offered. That does include IM injections, your vitamin shot bar, all of that is included. Those are medical services. They are injections. They require a prescription. I do get that question too. A lot of nurses will say, well, I'm only going to do vitamin injections, not IV therapy. Do I still need a collab or medical director? The answer is yes. So to sum it all up, in Florida, nurse practitioners are autonomous, but we are not full practice, okay? And we shouldn't ideally be doing medical director services, but we can in fact provide good faith exams, which establish that provider-patient relationship and clears a client to proceed with a med spa or a service such as IV therapy, medical weight loss, even hormone replacement therapy. Okay, so we can do that. So thank you so much for watching. I will be adding more and more content to the Concierge Nurse Life or Concierge Nurse Network YouTube channel on all things Concierge Nurse Life, things that affect our practice, tips for getting started, things that we should be aware of. So subscribe and stay tuned and park it here for more. Take care.